And welcome to our meeting. It's my pleasure to welcome you. My name is Karen Reimers, and I'm the president of the Rotary eClub of Florida. And tonight we have a special meeting where we will have a guest speaker who will also be inducted as a new member of our club, Jessica Branning, CEO of ClinCloud Research. And I would like to call this meeting to order. We can open with the Pledge of Allegiance. So, I pledge allegiance to the flag of the United States of America
and to the republic
for which it stands,
one nation, under God, indivisible, with liberty and justice for all.
All right. And so, yes, I would like to welcome everyone again and introduce our visiting Rotarian and special guest, Michael Vernon. Thank you so much for joining us today, our district governor, and also our non-Rotarian guests, if any. I think some guests from ClinCloud Research, colleagues of our speaker, Jessica. Welcome to our meeting. Yes, and yeah, I think we can continue our meeting. I don't know if we want to proceed with the speaker. Dr. O, do you have any thoughts on the order of events, or would you like to invite people to share a few words? Good news.
We had, I think, on the agenda, we had some correspondence. One thing we had, and I believe I sent it to you, was a letter of thanks from the about the donation to the Indian.
Yes.
You received a letter from the donation we made to India for the COVID donation?
I did, yes. Would you like me to read the letter?
Sure.
Everyone, okay, let me just pull it up here for a moment. I did just see that in my messages. Thank you very much for forwarding that recently. Just a moment while I get that. If anyone has anything else to share in the meantime, I'll just pull that up. See if I can. Sorry for the delay here. Let's see. I know you did send it. I'm sorry, I didn't realize that was part of our plan to share that with everyone, but it was indeed very nice to do. And it was one of the things we're happy to be able to do as a club is support some of these valuable initiatives there. Let me just see if I can find that wonderful letter. Just looking for it here. Let's see. Here it is. Okay. So yes, it was a letter dated June 2nd. That said, and it was from the past district governor, Paul Sincock, who was the treasurer of the District 6400 Foundation. And it was addressed to our club. Thank you for your contribution of $100 for Rotary's India Oxygen Bank project. Most of us can't imagine not having access to life-saving oxygen, and yet this is the reality facing many residents of India who are suffering from COVID-19. This project will help purchase much needed oxygen concentrators and other equipment to alleviate their suffering. And then it goes on to just, you know, whatever, talking about the receipt for tax records. But yeah, that is something, some correspondence that we wanted to share today. Thanks for the reminder about that, Dr. O.
Then you have, we want to share something that we have, that you have for Michael Vernon.
That's true. Yes, we do. Thank you for the, that's also under correspondence item on the agenda. Yeah, so Michael, we're just delighted that you can, or Mike, you go by Mike, right? I should know this by now. You've been sending us Mike's minutes all year. And thank you so much for all your wonderful leadership for our district as the district governor. And we'd like to present you with this certificate from the Rotary eClub of Florida to you for your leadership.
Well, thank you very much. That's an honor and privilege.
Great. So yeah, we have some other agenda items. I know our program will come, I guess, towards the end after some of these other items, including induction of our newest members, which is a very important matter of unfinished business currently, because we are absolutely delighted to have two new members to our club who are both with us today, Jessica and Natalia. So welcome. And I would be happy to proceed with the formal induction if that is okay with everybody.
I'm going to enlarge the words so that everybody can view them. Let me see. They mean a lot. They're part of our everyday, part of what we do in Rotary, and we'll rotate through saying them and as officers, and then the governor will induct, and we're very privileged to have him today to be able to talk about it and to do the induction. And actually, this was the one that when we inducted the club members here, when we first had our club meeting, when our charter occurred in 2016. So let me send this to you so you can all see it. And then think about the words as we share them. And these are the two Rotarians, Natalia and Jessica. You can start it, President.
Oh, sure. Yeah, so I'll read from this. So yes, so Natalia and Jessica, Rotary is an international organization of over 1.2 million business and professional people with Rotary clubs in over 205 countries. When one joins Rotary, she becomes part of a worldwide fraternity. You can travel throughout most of the world and find a Rotary club within easy distance. Rotarians will welcome you warmly, even though the language may be different, the food unusual, and the location far from home. The object of Rotary is to encourage and foster the ideal of service as a basis of worthy enterprise, and in particular to encourage and foster, first, the development of acquaintance as an opportunity for service. Second, high ethical standards in business and professions, the recognition of the worthiness of all useful occupations, and the dignifying by each Rotarian of his occupation as an opportunity to serve society. Third, the application of the ideal of service by every Rotarian to his personal business and community life. And fourth, the advancement of international understanding, goodwill, and peace through a world federation of business and professional persons united in the ideal of service.
And then all together, I charge you to judge yourself by the Rotary 4-way test of the things you think, say, or do. 1, is it the truth? 2, is it fair to all concerned? 3, will it build goodwill and better friendships? 4, will it be beneficial to all concerned?
Natalia and Jessica, Rotary is just on another club. It becomes a way of life. And I think you'll realize that as you get more involved and participate in club and other activities throughout Rotary. You were elected to membership because club members felt you would fit into this way of life. Naturally, you'll be expected to participate in Rotary programs probably regularly. Weekly becomes tougher these days, so I think regularly is a good word. And attend in-person meetings around the world without any reservation. Feel free to call somebody up and say, "Hi, I'm Rotarian, I'd like to visit, and I'd like to sit in your club." I think many of us have done that. I've had the opportunity to do that in many countries and in many different clubs. So take advantage of that because you really get to meet a lot of nice people. And you learn a lot about yourself and others. And remember our motto, which is service above self. You'll get out of Rotary exactly what you put into it. It's one of those things that the benefits you receive will be much greater than what you feel that you're going to put into it because you get things back greatly. and it's enjoyable and it's fun. And your club has already set out a path of service in doing many, many things. Sharing education, donating books and supplies, helping Rotarians in other nations, helping people in other nations, helping those who are in need, whether it be through hunger or homelessness. And you'll be able to see all that and enjoy that. And so, my fellow Rotarians, it gives me great pleasure to present to you Natalia and Jessica, the newest Rotarians in the whole wide world. Congratulations.
Yay!
Thank you so much.
Thank you.
It's a pleasure. I'm very much looking forward to it.
It's definitely a responsibility that we're growing to be able to take more effectively every day, and hopefully in unison we'll be able to learn and effectively do all these efforts that are so important for humanity. Thank you.
At the end of the month, you'll get a Welcome to District 6980 video. It will be my last video. And I'll try not to cry, but I can't guarantee that. But it's a chance to just learn about District 6980, because you'll learn more and more about your club as you go along. But I found that Rotarians don't much understand things that are outside a club. So I just want to give you a chance to learn about the big Rotary and how it's organized and where it is and what the heck a zone is. Who ever heard of that? And what zones do and how many there are and where we fit into things in the scheme of things. And it's just an opportunity to do that. And I, of course, ask you if you have any questions to please let me know. And Phyllis or Karen, be sure to send me their emails. Will they be in the DACDB?
Yes, they're in there already.
Okay, good.
Yeah.
So you get have the opportunity to get Mike's minutes this Friday.
Oh, yes, I get them every week, Mike. Yes. Mm-hmm.
And it's a great thing. I mean, I'm sure there are thousands of people that stay up all night on Thursday. Well, maybe
Waiting,
not.
just waiting.
Maybe not. Maybe it's only me. But they'll be there. And the whole intent of that is just to let folks know what's going on and to let you know what's going on in the district and make it personal, because this day and age of having to do things virtually is tough. And as Phyllis well knows, being virtual is different, and it requires different things. So that's the whole object of that. And if you ever have any questions, please ask. If I don't know the answer, I know who does.
Or he makes it up, you know.
Or I make it up. And then I just have to answer to Karen, because she'll say, why did you make it up? I said, I don't know. You like it? I liked it. But anyhow, please do let us know. We're glad you're part of the district. You have a great opportunity. There are lots of fun things going on. If you happen to be in the area on June 26th, join us for a picnic. We're working for, I don't know, Phyllis, I don't know if we're going to be able to do a Facebook Live or not, but we're going to maybe give it a shot and put that on. Be from 12 to 4. And the whole purpose of that day is just to say thank you to our members. No cost. Just come out and have a picnic. And so, we can send picnic food through the mail, maybe. What do you think, Karen? Can we get it all the way to Texas?
Sounds nice. Oh, I think so.
We'll try it. Anyhow, that's our intent, just to have fun. But thanks, guys.
Natalia, for the visitors, can you give us 3 sentences on who you are and what you do?
Yes, thank you so much. And I'm Italia Rico. I'm a recent Rollins College graduate. I'm a medical anthropologist. So I graduated with an anthropology degree, 2 minors, biology and global health. I am one of those individuals that understands that all species are working in unison, and specifically I'd love to help in the preservation of our species. So when it comes to health, I'm all over it, trying to research and learn as much as possible. But I'm also working for 2 different companies, very briefly. One, Q-Latinx, when it comes to eradicating the HIV and AIDS epidemic here in Orlando, but also through vaccination, we're working against the pandemic. And as well, and lastly, I work with IRI, which basically I'm a fundraiser for a political initiative. So I'm trying to expose myself to as much as I can to learn. So I appreciate any sort of tip. I'm here to learn and grow together. Thank you.
And I just hooked her up with a group that she's going to come out to Apopka and help us with eradication or testing out here. And so, and then I hooked her up with our other member here in Apopka who just got over COVID. And we're going to be doing hopefully COVID shots here in several places, including one of our members' locations. So we've signed up for a whole lot of COVID shots. And hopefully other Rotary clubs will be able to volunteer and come and help give COVID shots throughout Central Florida with us.
Definitely the goal is herd immunity. So if you guys have any questions when it comes to resources for those things, HIV, AIDS, or COVID-19, here I am, here we are together.
Yes. Thank you. Karen?
Yes. Thank you, Jessica. Well, I guess we'll learn a little bit more about your vocation soon during your talk. Mm-hmm. Would you like to share briefly with us now too about your vocation, since it's part of the introduction of our new members?
Absolutely, absolutely. Well, firstly, I wanted to say, Italia, it must be a great day for us because I'm a Rollins alumni too. So we were cut from the same cloth there, so that's fantastic. I actually majored in biology. There you go Tars. And I think our missions are very similar, to the tune of we're here to help preserve, from a medical standpoint and a health standpoint, the lives of so many. For me, my focus has been more on the geriatric space, which is why I started to open up my own clinic, ClinCloud clinical trials, in the hopes to help make a difference for our future generations, so that we can look to change the way that we treat, diagnose, and prevent diseases such as Alzheimer's disease, MS, Parkinson's, some diseases that are so detrimental and live with us for such a long period of time, trying to help be proactive about our health. And it's funny that you also talk about COVID as well. It's one of the initiatives that we started with was helping to run the clinical trials for treatment. So we helped to do treatment for the Regeneron treatment drug for COVID-19, and we were out swabbing and testing people during the thick of COVID. So I'm glad I'm here to share the spotlight with you, Italia, and with everybody else here today, just in regards to our missions.
This is just a sign that we're a stronger team together.
Yep, exactly, exactly.
Wonderful. Well, thank you so much. And without further ado, Jessica, if you're ready, we would love to start the formal program with your presentation.
Absolutely.
Yeah, screen sharing, excellent.
Great. So as I have already alluded to, I'm very excited to be here today, and I'm very pleased to be able to spend time learning and growing together through the Rotary Club. So ClinCloud in general has always been focused or created with the idea and concept that our goal is to help improve medicine at large for our future generations, so that we're able to live longer and be able to provide new treatments for such conditions such as Alzheimer's disease and Parkinson's, so that we can have a better quality of life in general. So why is ClinCloud here? What do we do? You know, we're founded on the presence of we identified that there's a huge issue with Alzheimer's disease that runs throughout the United States in general. When I very first started my career in clinical research, I did not realize how detrimental this disease and this condition was to so many. As you see here, 580,000 patients who are 65 and older just in Florida alone suffer from Alzheimer's disease. And that really expands out even further to their families and including their friends as well. It affects so many more people than just the individuals that are living with this condition. And we've started to peel that apart as we start further understanding all these neurological conditions too. Parkinson's is another huge neurological condition that doesn't have very great treatment options, and those treatment options that are available tend to be extremely expensive for patients to get. So there's still a need for clinical research to help find better treatment alternatives and truthfully better ways to prevent the onset of these diseases, or at least be able to diagnose sooner so that we can intervene sooner rather than later. And as I mentioned too, there's 2.67 million caregivers alone throughout the state of Florida that are caring for individuals that have Alzheimer's disease, Parkinson's, and other different types of dementia. So again, this is not just affecting those that are having the condition themselves, but affecting a huge organism of individuals in general. And not to mention the cost for caring for individuals with these such conditions is astronomical. It's between $45,000 and $61,000 a year to just help treat and help with their quality of life, from placing them in homes to their medical care and whatnot. And I really feel as though that clinical research serves as an excellent way to help provide hope for our generations, help for us to look at ways where we can mitigate the cost of treating these conditions by helping to intervene and prevent sooner rather than later through some of the wonderful tools that we can get out of exploring through clinical research trials. So our medical team is composed right now of two predominant physicians and an ARNP. Dr. Esteban Oliveira is our medical director, and he's been in clinical research now for over 5 years, and his expertise has been in emergency room. Prior to clinical research, he had about 20 years of experience in the ER, where he learned the devastation of Alzheimer's disease, Parkinson's, other neurological conditions, and what that can do to family members, as he himself has also experienced watching family members go through these conditions. And then we also have a very amazing team of geriatrician and geriatric ARNP. Dr. Rosemary Laird is a predominant geriatrician who's actually going to be heading up our Vieira location with a primary focus on all different types of dementia and general geriatric health. And then Patty Quintillo-Cajas is also an investigator at our Maitland location, where she is predominantly focusing on memory disorders as well. We do clinical trials that are from phase 2 to phase 4. So these different phases are essentially evaluating ways where we're able to look at the efficacy of a new diagnostic or treatment alternative to those that are currently out there. And we've been open now for about 3 years. And I'll go into a little bit more of the indications that we're primarily focusing in. So as many of you have heard, my primary focus has always been on Alzheimer's disease and the different types of dementia, because right now as of a week ago, there wasn't a cure for Alzheimer's disease, or there wasn't really effective treatment options that have been made available. And my goal was to be able to create a safe place where individuals who are starting to learn of concerns with their memory can get free care, whether it's through a clinical trial or not through a clinical trial, so they can learn and obtain a baseline as to where their cognitive function is at. So when individuals come to ClinCloud, they have the opportunity to get a medical screening conducted at no cost to them. them. It is a battery of assessments. It's almost very similar to a mini neurocog assessment that they would be getting conducted, where they're able to learn and obtain where their cognition is at. And then from there, we can further explore what are some other resources that might be available to them. And we start to create almost like a care plan for them. So research might be one resource that is available, and we'll go into detail and educate on the clinical trial that would be the best match for them. And or if we don't have something, we can start looking at other resources. So we also offer free mental health counseling for patients that have recently been diagnosed, or their family members who have recently learned that a loved one is going through Alzheimer's disease. And it's mentally very draining for our caregivers, and they really need a great support system or somebody just to talk to as they're going through this. We recognize the need for this, and we're here to provide those free resources to those that need it. We also do group support groups, and we've partnered with other nonprofit organizations such as the Alzheimer's Disease Resource Center, the Alzheimer's Association, and other organizations within the greater Orlando community, so that we're able to connect patients and their caregivers to additional resources that we might not be able to. So it's all about education and providing them with the means to live a better lifestyle and or get the resources that they need to improve their quality of life, whether that's through ClinCloud services or that's through another organization services. We're here to help match and navigate through all of the different resources that are out there. In addition to the memory and Alzheimer's disease clinical trials that we do, what we've started to learn is there's other comorbidities that could potentially contribute to the decline of brain health over time. And one of the key ones that we've started to uncover is our liver health. NASH is a pretty predominant, what we call a silent epidemic here in our country, and it's due to how we eat, how we exercise, other comorbidities that we are living with, from high cholesterol, hypertension, diabetes. We don't realize that it's affecting our liver health too. And if our liver is not working properly and over a period of time, it can cause other health complications, potentially even leading to different types of dementia as well. So we do offer free liver screenings to everybody in our community as well, so that they can get a good idea as to where their liver health is at. So not only are we focusing on brain health, but we're also looking at our liver health too. And we do offer clinical trials in that area as well, or that therapeutic as well, that can actually reverse and help treat the condition as well, because our goal is to help our goal is to not have it go into cirrhosis in general. So as I mentioned before, education about all different types of medical conditions and symptoms are really important to us. So we make sure that we cater each visit, whether they're coming in the first time or they're coming in for their last appointment with us, that we always are keeping them well informed as to what is going on with their condition, if there's new resources that are available and whatnot. All of our team members are highly trained medical professionals within memory, liver, other GI disorders, dermatology, what have you, depending on the clinical trial, so that the patient and their family members are feeling very secure with the resources that they're being able to provide. And not to mention, clinical research in general really is able to provide a vessel or a pathway to new ways that we can treat and diagnose some of today's worst illnesses. For instance, COVID-19, it was through clinical research trials that we were able to get the vaccine, we were able to get treatment to the larger community, so that we can have herd immunity and help combat some of these devastating medical conditions that we're working with. And clinical research is able to provide us with that opportunity to know better and take control over our health in general. So as I mentioned, we do more than just the memory loss. I know that's been the core focus of my presentation thus far, but we have also learned to do clinical trials for migraines. We have a wonderful clinical trial right now that's focusing on different biomarkers that might put somebody at risk for Alzheimer's disease. Through programs like this, they're able to obtain not only new blood tests, but they're also able to obtain imaging as well that allows for them to better understand, do I have the certain biomarkers or characteristics that could potentially cause my memory to decline or would put me at a higher risk for developing Alzheimer's disease in the future. And we're able to provide those diagnostic needs to patients at no cost to them, which I think is one of the most beautiful things that we're able to do through clinical research. Is some individuals, especially as we age, might not necessarily have the funding to get some of these diagnostics, and sometimes stray away from being able to talk to somebody about their memory care or their memory needs because they're fearful of the cost burden that comes with that too. You know, again, we focus on dermatology. We've done fatty liver, gastroparesis, diabetes, Parkinson's. We're doing MS too. So there's a lot of different research programs that we're focusing our attention on. Just as we've continued to grow, we want to be able to help as many people that we can who are living with some of these illnesses. So as I've mentioned a few different times, through clinical research, through their participation, we're able to provide this at no cost to patients. No insurance is involved. So they're able to get a pretty dynamic workup in an accelerated period of time to learn more about this health condition that they're coming in for. We have actually been able to launch some virtual visits during the thick of COVID. We actually worked with a few sponsors, pharmaceutical companies, and other government agencies to actually launch clinical trials from a virtual standpoint. So we're one of the first sites that have actually gone paperless. I know that's quite amazing to some, but clinical research has been done on paper for quite some time now, and we're really testing the limits and helping to incorporate new technologies so that we're able to provide clinical research as a care option to more individuals nationally, not just who live within our general vicinity either. We are bilingual. We do feel as though this is very important for our patients and our community to be able to provide services not only in English, but also in Spanish. And our hope is to continue to expand upon that. We do focus on the elderly community, but we want to make sure that we also focus on minority populations as well, especially from some of the initiatives that we've been doing here locally is trying to provide these healthcare services, these free healthcare services to areas throughout Central Florida that don't have the means or don't have healthcare options by not having insurance or things like that, through a lot of the free screenings that we're able to provide. And as I mentioned before, we do a lot of mental health counseling, we do support groups, and we're helping to pave the way towards new treatments and diagnostics. So here's just our overall goal: is we want to help to support one another. We want to be able to connect in with physicians, connect in with patients throughout the community to help highlight and educate them on the importance of participation in a clinical research study and all of the wonderful benefits that it's able to provide. Most clinical trials will allow for individuals to receive a full panel of blood work, ECG, physical examination, vital signs, BMI, education on the disease itself, and they go through a whole battery of diagnostics to learn whether or not they have the condition. If they do have the condition, what stage of the condition they potentially are in, and then they have the opportunity to potentially receive cutting-edge treatment options, which is great. And we are also paralleling our research initiatives with the resources that are available. So that's one of the big things that I'm really excited for by being a member of the Rotary Club, is being able to learn more about what resources are available so that we can start providing more of a guidebook or guidance really for our community and navigating through all the resources that are available. So again, just looking towards the future, we really want to be able to grow and expand and offer clinical research as a care option to everybody in our community, and hopefully nationally one day, so that we're able to utilize our technology and be able to see somebody, in Boston from Florida or from Texas, and be able to provide all of these services to those that really need it. These are just a list of some of our partners that we have. As I mentioned, we work very closely with a few nonprofit organizations and also home care organizations. We've worked very closely with Advent Health support groups and their physicians too. So we're really looking forward to continue to grow this partnership so that we can help our community. And this is just our information so that you'll all have it. And then these are our locations. We are located, our main clinic is in Maitland, Florida, and we are opening up our second location, or rather, I should say our third location, because we had a COVID-19 clinic in Maitland as well for some time. But we are opening up our Viera location the second week of July. So I appreciate your time and I'd be happy to address any questions that you may have.
First of all, wow, thank you so much for the explanation. I am very proud of my TARS, but everything that we're able to do and learn from, from not just our education, but our experiences working with other organizations. So good job. And if you guys need any help when it comes to resources on the pandemic or on HIV and AIDS, I mean, Q Latinx definitely has the funding and the ideas. And also, if you need any other extra help as a medical anthropologist, here we are working together. A question, I guess, if you have any challenges when it comes to the bilingual world of this whole movement, please, you don't hesitate to ask. There are so many resources, and I'm definitely bilingual myself, so we can definitely work in teamwork. But also, a question when it comes to the organization. What about the undocumented, community? Because obviously, Florida definitely has a grand number of undocumented immigrants, and we'd also like to make sure we address that those epidemics everywhere.
Yeah, and that's, again, one of the beautiful things is that's not something that's required for them to potentially receive the free services that we're able to provide, from the memory screenings to the liver screenings. We do free A1C checkups, glucose monitoring. We don't require that information. We're just here to say we can do it for free, and you don't need to worry about your insurance, and you don't need to worry about paying for the cost of receiving just general medical care, should this be an option for them.
Perfect, and thank you. And then maybe one little tip, I don't know if it's extra. I have noticed that everybody does their taxes, right? So I've actually spoken and done some anthropological work with tax workers or tax companies and their individuals, and they say, we've always asked these public health questions, we don't know who to send them to. So maybe that's another idea, maybe to connect with the local or national or however we can local with these companies, because these individuals get to talk about so many health issues, and it would be great to have that public stance.
Yeah, absolutely. I think that sounds wonderful.
Free library and Barbara Answer inside Charity and Love. And I did see a Charity and Love Partnerships logo.
I know, I need to update it. It's on our website, so go check out our website.
Yes, it's on our website.
But Tracy and I met, and I extended an invitation to join the club, and y'all joined. But Barbara is a great asset to both our club and to you, and to get people to get their medical care through you, to get them to be tested, is incredible. I have recommended so many times prior to knowing Barbara was sending people there. I have sent so many people from Apopka there that I meet, people at restaurants that don't have insurance, waitresses and waiters and dishwashers and stuff, that they're able to get an MRI or they're able to get a liver scan or whatever. They're complaining about not having any care. And to be able to get tested for something is just incredible. The other day, when one of our patients, came in and they were just going through a general workup for a migraine study. They suffered from migraines, and they got an ECG as part of their workup, and we found out that they had AFib.
You know, aside from that, they had no idea that this was a situation, and they were relatively young. And, you know, through our connections and partnerships with a lot of individuals, you're able to get them into see a cardiologist very quickly, and the cardiologist waived, you know, their first initial, you know, screening with them because there was a medical necessity. But it's things like that and those partnerships and that education that we're able to say, hey, you know, you're taking these initiatives, you're taking these steps to be proactive about your health, and we might uncover something that you had no idea about. And that happens every day to us.
Expensive an MRI, you know, to be able to get an MRI done, that's very expensive.
Exactly.
It costs for me on insurance to be able to get it free, and she has no insurance, and for her to get a free MRI is fantastic.
Yeah, and the PET scans too. I mean, the PET scans alone are $5,000 for a patient to get an amyloid PET scan done. You know, and MRIs.
Sign me up right now.
I will. We'll have to give you a call. Tracy, get on that.
Yeah, I can give you a call, Dr. O.
Okay, please. In the morning.
Okay.
Yeah. So for people to be proactive in their healthcare, I mean, I'm going around in circles right now with doctors, physicians. I'm a doctor. So with physicians' offices that it's just amazing how they tie their own hands sometimes, but between inept policies and insurance loopholes that keep them from doing what they need to do to make people healthy. And we got to wait for that paper.
Yeah. And that's part of it too, is, you know, one, you know, with clinical research, we have to do it in an expedited amount of time as well. So we have to be able to get labs done, ECGs, MRI, PET scans. You know, if you're doing a liver study with us, a liver biopsy, we all have to do that within 2 to 3 months of understanding. So you get that expedited care and you get the feedback as well. Not on everything, because some things from a clinical research standpoint have to be blinded, but any local reads, any labs, any ECGs, anything like that, we're able to, you know, provide that back to the doctor as well. So even if the doctor is on a wait, that's one of the things that we've been doing with Advent Health's memory disorder clinic. The wait to get in to see one of their memory disorder specialists right now is 8 months. We've forged a partnership where we're able to at least identify and get the patient started with their workup. So by the time they are able to see the memory disorder specialist or the geriatrician, neurologist, what have you, they've already gotten labs done. We've ruled out that it might be a vitamin B12 deficiency that's causing cognitive problems. They've got a full baseline of their memory assessments. Some are coming with MRI scans, PET scans, so that they're not starting from scratch when they go to see their doctor. They're at least the doctor is able to say, hey, I've got all this information from your participation in a study, and I can help better treat you if, say, the study doesn't work out, or if it does work out, what can we do in addition to your participation in the clinical research study, you know, and that way they don't need to repeat blood work all the time. I had a conversation the other day with a physician who said it was amazing because I didn't have to repeat the blood work because the blood work was all right there, and the patient didn't have to pay to have that done. So we're expediting, and we're trying to streamline the individual's care amongst all of their physicians that are working with them. Changing the narrative, right? I mean, education is a very powerful thing. So if we start educating on being proactive about our health in general, and we're able to diagnose and have these resources that are able to say, hey, you know, I am at risk for liver disease, or I am at risk for Alzheimer's disease or diabetes, we can start intervening, and it doesn't have to be necessarily through treatment. It can be through, I need to change my diet up. I need to, you know, physically be better, or I've got that prevention. I've been proactive about my health, or I've simply been getting the education now of how I can advocate for myself. That's the biggest thing that we do as well here, is we say you have to make sure you're advocating for your health, and that your family member is advocating for their health and your health as well. That's a big thing that we promote, because there's so many, like you said, that, you know, they go through this process of, you know, going through test after test after test, and they never speak up until it's to the point where either it's too late, or we could have intervened much sooner on in the process. So
Mike and Karen, I don't know about your former clubs or your clubs, is that when I was at a previous club that we had 6 nonagenarians that we did an event for, all 6 of their wives, they were men, well, 1 woman, but all 6 of their, 5 of the men, their wives all had dementia. All of them. The men had been in war, World War II, but all 6 of their, the 5 wives had dementia. And they have, ClinCloud has a caregivers support group. Mm-hmm. And if just letting our members know that there's a caregiver support group that they could be part of would be phenomenal.
And we try to do it on the weekends and in the evenings too, because we realize that not everybody is available, and there's a lack there of resources on the weekend and in the evening times, because most of our caregivers are working, you know, so they don't get the access to those support groups.
Mm-hmm. Yeah, that's a good point. Definitely caregiver burden is a huge thing to consider, and the caregiver's health is, you know, very, you know, jeopardized as well by all of this. So yeah, thanks for all your work coordinating things. I think the Alzheimer's Association is a very tried and true resource too, and a good one to collaborate with. I know they do a lot to support families one-on-one too.
Yeah.
We have something to share with you. We didn't share with you the membership of the speakers. A speaker certificate. We appreciate your giving a speech to us. We will send you this.
Thank you so much for having me.
Thank you, Jessica.
Jessica, wonderful job, and keep up the good work.
Thank you very much.
You too.
Great job, Jessica.
Thank you.
And for some reason, it's not going forward.
There's Italia.
There we go. Oops. Yeah. Oh, it just jumped. It decided to jump. And Italia. And then we also have your membership certificates also. And you can, the membership certificates you can also wear as a badge, can be made miniature and worn as a badge when you go visit other clubs anywhere in the world.
Great. I can't wait to go somewhere else in the world.
Yeah.
Ooh, I wish.
Italian's hard work, right?
Yeah, I mean, especially as a DACA recipient, I'm like, yeah, I really hope that I get to travel a little at some point. But we're fighting towards that. We're fighting towards the justice of humanity, because that's what we are. I mean, we don't see snakes fighting each other for color. So we got it. We got it.
Yeah.
Well, Jessica, you can go to Viera. Go to a meeting there.
Yes.
Yes.
Absolutely. I'd be happy to.
Yeah. And go to any location.
Okay.
Mike can go with you.
All right, Mike, you and I.
We can do that.
Thank you.
Well, I'd like to thank everybody for joining us tonight for this wonderful meeting. Thanks again, Jessica, for your excellent talk. And welcome again to our 2 newest members, Italia and Jessica. yeah, I guess it's time to close our meeting. Often we adjourn with the 4-way test, but we already went through that earlier. Without further ado, I'd like to adjourn this meeting, and thank you once again for joining us tonight.
Thanks, everyone.
Thank you.
Thank you.
Thank you.
Good night.
See you Friday.
Okay. Bye.
Bye-bye.
Now, Karen, we